Hi, good afternoon, everyone. I hope you all can hear me. You all can see me very, very clearly. So, I'm here just to share one very important information with you all that today we are launching a regular batch. Okay, and this regular batch is being started to target the NEET exam 2022. As all of you are already aware, as per the NMC rough draft that has been released just a couple of days back, it has been informed to us that the exam will be tentatively held in the month of April 2022. So what we can do is we can start preparing, we can start doing the yeah so we can start preparing for it. So what we have done starting from today is we have started this new batch, and this new batch will be targeting your NEET exam 2022. All the 19 subjects will be taken live. All the 19 subjects will be completed by the month of March. And still then, if we go with the rough dates of the NEET exam 2022, it will be completed in the March, so that you have some time for revision for yourself. Okay, so today the link will be open here on the YouTube channel. Today we are going to have a class of biochemistry, and that will be relayed live for all of you. So all of you can easily actually understand that how the classes are relayed on a live medium. All these 19 subjects will be conducted on DBMC live app. Okay, and from tomorrow onwards we are starting a TND batch also, the test and discussion batch also, and that TND batch again will be targeting the NEET exam 2022. So tomorrow we are having a class of ophthalmology by Dr. Neha. Today we are having a class of biochemistry by Dr. Ankur, and both the classes, today's class as well as tomorrow's class, will be having an open link onto the YouTube channel, on our official DBMC YouTube channel, and you all, everybody, will be having access to these classes initial sessions, right? All the idea is to give you the clarity that how the classes are relayed on a live platform. Obviously the faculty will not be listening to you on the YouTube channel, because then they will be connected only with our enrolled student. So they will be only able to answer the queries which are raised by our enrolled student in their respective batches, because they will not be, the faculties won't be looking at the YouTube channels at that time, right? So in a couple of minutes from now, around just 5 to 6 minutes from now, we'll be starting with our biochemistry classes. So anybody, if wants to know something more about these, you can very well connect with our team, or you can just message me. I can put my WhatsApp number over here. You can just message me, or to our student support mail ID, or search me on Telegram, and you can just ask me anything if you want, right? So to all those who are preparing for the NEET exam 2022, be a part of it, assess and just feel how the live classes are, how a faculty teaches, and how it's going to benefit you. So let me tell you again, the batch that we are starting today, it will be ending in the month of March, so that you have ample time to revise for yourself in the exam in April 2022. And the TND batch again that we are starting tomorrow with ophthalmology class will be ending in the same month March, right? So this is that I wanted to share with you all, guys. So just enjoy the class. In a couple of minutes we'll be starting it, right? So for any queries, you can just message me, you can message my team, you can message the student support mail ID. So everybody is there to support you out for the upcoming NEET exam. Okay, so thank you so much everyone for.
Good afternoon, friends. So, now we are going to start biochemistry. We will take around 50 hours to complete biochemistry, and you all know that biochemistry is very volatile. So, I will give you many mnemonics, many concepts, so that it would be very simple for you to retain it. So how we will proceed in our biochemistry for 50 more than 50 hours? So we start with the concept, that mnemonic concept and conceptual things also. So let me give you few mnemonics and let me ask one question. Okay, a question was asked in which a graph was given. Okay, this graph was given, in fact two graphs were given, or you can say this, and they ask, yes, this, suppose this is A, this is B, and they ask A and B are for glucokinase or hexokinase. If I ask you glucokinase is A or B, yes, definitely we will remember it by concept also. Remember the point. Yes, many times we make mnemonic to save time. Concept is always essential. Yes, I will elaborate memory technique in my class. The whole class will be conceptual and in a very precise, regulated way or in a planned way, so that you will develop a memory technique. You will be habitual of memory technique. As I usually say, memory is nothing but habit. So this mnemonic is to save time. Definitely when we will study glucokinase, hexokinase, you will learn why this graph is for glucokinase, why it is for hexokinase. You can simply remember glucokinase, G for glucokinase as jet, G for jet, hexokinase as helicopter, hexokinase as helicopter. Yes, why I have given, you all know that helicopter. Do you have picture of helicopter? You have picture of a jet. But the purpose to give, yes, memory technique, visualization, yes, imagination. Later on in my discussion, I will not give you the photo of these things. I will ask you to imagine a particular thing and you will learn how to imagine. So we don't know which graph is for glucokinase, just remember, or which is for hexokinase for helicopter, and you know how helicopter fly. Helicopter like this, helicopter moves like this, then this, and you all know jet, zoof. Okay, so this graph is for glucokinase and this is for hexokinase. So simply you can remember helicopter moves. तुमने देखा होगा पहले हेलीकॉप्टर ऊपर उठता है फिर ऐसे चलता है, ठीक है. और if you want to travel a short distance, yes, you must have visited many places, just like Vaishno Devi, where for a short kilometer, what I said, short kilometer, if you want to travel short kilometer, you will use helicopter, low km. Hexokinase has low km. Jet, if you want to drop bomb to other country, Pakistan, we usually say, Indian usually say like that. Yes, yes, then you will use jet, and you can easily see the graph also of jet. Yes, you can easily see that jet. Okay, this is graph of jet, and yes, high kilometer, long kilometer, yes, high km. And you all are aware that affinity is inversely proportional to km, or km is inversely proportional to affinity, is the same thing. Km is inversely proportional to affinity. So if it is having high km, so low affinity for glucose. And it's having hexokinase, low kilometer, छोटे किलोमीटर के लिए जाना है, high affinity for glucose. If you see the question on hexokinase and glucokinase, most of time you will solve question by this mnemonic only, but I will discuss this point in detail with concepts. Though again I repeat one very important statement that yes, many times we make mnemonic not due to Yes, not due to remembering but to solve question in exam you must have experience who have appeared this time that yes, we are in troubled state of mind. When we are in troubled state of mind, yes, our anxiety interfere with recall, so at that time these memory techniques help. So keeping in the mind, yes, we will proceed like that. Yes, one more mnemonic, picture mnemonic again. You must have use tank. This is a energy drink and this is most common flavor is orange flavor. Yes, this is, yes, looking like orange. If you have, yes, you must have eaten orange, just like orange pattern or orange color tonsil. Yes, orange tonsil are found in Tangier disease. In which disease? Tangier. It doesn't mean that I will not discuss Tangier disease in detail, but you will find that this is a very specific feature. Picture MCQ has been asked on Tangier disease. So you may remember by the tang only, tang orange. Yes, this will always remind you. Okay, so I gave two mnemonic. One more mnemonic. Yes, all these are recently asked question. Hunter's disease. Hunter's disease. Mucopolysaccharidosis. I am going to discuss mucopolysaccharidosis in detail. Yes. Hunter's disease, you know, hunters. Hunters are usually male. Hunters are usually male. Definitely. मैं हूँ शिकारी कुड़िए, खाली मेरा वार ना जाए. तो male, it is commonly in males. Okay. And yes, if you see, it is X-linked. Two guns, I have taken this in the form of X. So this is X-linked recessive. So you can easily remember if X-linked recessive, it is more common in male. This is common question. Okay. And if you are a good hunter, your vision would be very sharp. There should be no corneal clouding. So all mucopolysaccharidosis we will discuss. Yes, in most of mucopolysaccharidosis you will find corneal clouding of cornea, but no corneal clouding in Hunter's disease. No corneal clouding. So all our question, this is Hunter's disease. Hunter's disease. I have kept in the initiation of class. The purpose is that to make you confident that biochemistry is not a difficult thing and biochemistry is the rank deciding subject. Why I say it is rank deciding subject? Yes, there is limited questions, limited topics from which questions are asked. NEET has proved it. Many times same question, but you don't remember even the same question. Means you can put little bit extra effort, little bit mnemonics, and you will remember, yes, complete. You will remember complete biochemistry. You will can achieve 100% in biochemistry. Okay, but few advancements are always there, you all know. So let me ask one question. Yes, we are connected with the Telegram group. This is the beauty of online thing. Yes, so if I ask you question, this question has been asked thrice or four times in aims, and I think you must be having the correct answer in your mind. So what is the answer of this question? Thiamine level is the best monitored by. Please do reply. I will wait for some time. Okay, so you think and you reply. I know there is somewhat lagging, so keeping in the mind, I am going to tell one more mnemonic. Meanwhile, I will wait for your reply. Okay, got this point? So one more mnemonic, Farber disease. Farber disease. Yes, Farber's disease. I usually say Farber as barber. BARBER. This is barber. Yes, बच्चों को हम राइम सिखाते हैं. We'll make our kids yes learn rhymes. The purpose, each and every point in our life, teaching in our life has a meaning. So you can use rhyme method. Farber barber, barber सिर के बाल काटता है. Sorry for those who can't understand Hindi, I know, but they can ask to their friends. And trust me, yes, I am not giving the mnemonic, I am going to give you the concept how mnemonics should be framed. Okay, in 50 hours I assure you, you will be habitual to make mnemonic, then you will make the reflex to make mnemonic. And I told you that memory is nothing but habit. Okay, so farber barber, yes, सिर के बाल काटता है. Sarah my days, Sarah my days, yes, Sarah my days. Good, I am getting so many responses. So Farber disease, deficiency of enzyme, Sarah my days. Okay, तो सिर के बाल काटता है, Sarah my days. Yes. So we have learned 4 mnemonic. Yes, I would have given more mnemonic at this place, but I restricted my desire. And now I am going to, yes, the answer of this answer is second, B. Yes, this is recent advancement. Yes, I gave you only 1 point about recent advancement. You know, biochemistry is always evolving. Yes, just like, yes, I used to teach 8 year back. At that time, 7 year back, I used to teach there are 33,000 genes in our genome. But now I started teaching. Yes, there are only 25,000 in Harper. Harper says 25,000. Marx says 20 to 25,000. Yes, what is the exact value? I will tell you for the time with genetics. For the time being, this. In this, answer is B, not A. Yes, previously 15 years back when this question was asked in AIMS, at that time the answer was A. But now we can directly measure the free thiamine and active form of thiamine, that is thiamine pyrophosphate by HPLC, high performance lithography, latest edition of Marx and Devlin. Okay, standard textbook Leninger, they have clearly given all these points. Okay, now you would be surprised, sir, how can it be possible? This question was asked recently in AIMS and we all marked transketolase activity. You marked wrong. Yes, if you are having any doubt, you can call Lal Pathology Lab. When I was in Lal Pathology Lab, at that time it was started, we used to send the sample to USA. Okay, you can call Lal Pathology Lab. Yes, I want to measure my thiamine level. Can I do that? Yes. Can you take sample? They will say yes. It would take 7 days and it will cost around 10,000. Yes. So if question is best, yes, this question was asked in AIMS. We don't know that what was the question. If it is best, the answer would be thiamine, directly thiamine level. But if it is asked most common, yes, they will also tell you, yes, we can measure indirectly. Yes, that is quite affordable. So most common, then if question is most common, then the answer would be A, because you all know transketolase vitamin B1 is cofactor for transketolase activity. So we can indirectly measure the level of vitamin B1 by transketolase activity in RBC, but we can also directly measure. So best method, thiamine, free and active form of thymine can be measured by HPLC. But if question is most common, then answer would be yes, I have taken different color. Clear? So in the same question, yes, related to B1, there are few more advancement depending on the clinical scenario. So I will point out that not at this time. This was just introduction. The reason, yes, you all know I am a biochemist and I am also psychiatrist. Yes. So yes, I have gone through these phases 2 times in my life. Rarely got, yes, many few person only get this chance. So I got by chance or by luck, you can say. So now we start our biochemistry with conceptual thing. It was just an introduction. Okay. And definitely we have covered few questions also in this introduction. Now our first topic would be carbohydrate. I start with carbohydrate, and I would say that I have given few structures in your handout. I was little bit late in giving these handouts, but don't worry. Today evening I will provide, in the night I will provide all the handouts, depending on your performance in your class, depending on your response. Yes, how much we cover the topic in the same, at that, on the basis I will provide the number of handouts. Okay. So we start carbohydrate. Yes, carbo means carbon, hydrate means water. Now we are starting conceptual part, and you will remember only by concept, no mnemonic. Okay. And whenever I say generalized statement, means you can use that statement in each and every question. Every time your answer would be correct. So I am starting carbohydrate. Carbo means carbon, hydrates means water, CH2ON. This is the empirical formula of monosaccharide. Monosaccharide or carbohydrate. Okay, or carbohydrate. If N is 6, this is C6H12O6, prototype of carbohydrate, that is glucose. So you will write, you all know. Yes, you all know glucose is C6H12O6. Initially my speed would be low. Again I say, initially my speed would be low. Gradually, when you will be familiar with my ascent, with my pattern of teaching, then I will increase my speed. Okay. So we have to spend 50 hours, more than 50 hours. So no need to worry. Each and every point would be cleared. Whatever you have doubt, you can ask me in between the class or after the class. That will be replied promptly. Don't worry. So glucose is having C6H12O6. We found that fructose is having C6H12O6. Galactose is having C6H12O6. Mannose is having C6H12O6. We found that glucose, fructose, galactose, mannose all are having same molecular formula, that is C6H12O6, and we all know compounds having same molecular formula are called isomers. So you can say that glucose, fructose, galactose, mannose all are isomers. So I will discuss isomerism separately. Yes, I have arranged the content. Yes, I have given handouts, and I told you that yes, take two printouts of few pages. The reason is that I will try to correlate. Yes, I have arranged in such a way that I will correlate all the things. Yes, all the things, so that you can have a mental picture of integrating things in biochemistry, because you know integration in a subject is a very important concept, and integration is the key of memory. So So if you take printout, yes, in next class is okay. If you can't, it's okay. Yes. So glucose, fructose, galactose and mannose are isomers. They are isomers. So for the time being, we remember the structure of glucose and fructose. Yes, if you want to draw the structure, you can draw, but I will not. For the time being, look at this. This is having 6 carbon, 1 2 3 4 5 6 carbon, and at carbon number 1 there is CHO. This is CHO is aldehyde. CHO is aldehyde. This is glucose is having aldehyde at carbon number 1. That's why glucose is aldose sugar. Glucose is aldose sugar. Aldose sugar. So question is asked, the functional group of glucose is aldose. Very simple question. And the functional group of glucose is present at carbon number 1. But if you see the structure of fructose, as I told you that fructose and glucose are isomer, I have already told you, having same molecular formula. But we found that in fructose there is keto group. Which group? Keto group is there at carbon number 2, C1 C2. So fructose is having keto group. That's why fructose is a keto sugar. Keto sugar. So name itself tells you many things. Keto. Keto group is present at C2. Keto group is present at C2. What is the significance of the position? Again I say, don't forget this structure. I will solve 15 to 20 question on the basis of this structure only. Okay. So fructose is having keto group. So that's why fructose is keto sugar. Glucose is having aldehyde group. That's why aldose sugar. Means glucose and fructose having same molecular formula but different functional group. They are having different functional group. That's why they are functional isomer. They are functional isomers. Yes, a question was asked, fructose is functional isomer of glucose. Okay, fructose F4 functional isomer, because their functional group is different. And you will remember aldehyde is always present at carbon number 1 and keto group is present at carbon number 2. You know by your previous knowledge 10 plus 2. Biochemistry, chemistry is also part of biochemistry, so we will remember only few structure. I usually say 20, 25, sometimes 30 structure you must know. I say the complete biochemistry you must know 30 structures. I would not say more than 30, and you will remember each and every question by heart. So you can't forget the structure of glucose and fructose, because you will find that there are so many OH. OH means alcohol. OH means alcohol. And the suffix of alcohol is ol. So there are so many OH, 5 OH. There are 5 OH, 1 OH, 2 OH, 3 OH, 4 OH, 5 OH. 5 OH. If 6 carbon atoms are there, OH are 5. If I ask you ribose, yes, you will read the structure of ribose. Recently they have asked question on the structure of nucleotide, so you can't afford to forget the structure of ribose. Yes, you will find that the ribose structure is having 5 carbon. So if 5 carbon atoms are there, 4 OH. Ribose is having 5 carbon, 4 OH. Glucose is having 6 carbon, 5 OH. Means 1 less than the number of carbon, and that is ol. Ol means alcohol. Yes. So definition of carbohydrate. Yes, carbohydrates are aldehyde. Carbohydrates are aldehyde and keto derivatives. Keto derivatives of polyhydric alcohol. Polyhydric alcohol. Yes, carbohydrates are aldehyde. Yes, aldehyde and keto. Yes, keto derivative of polyhydric means so many OH group alcohol. This is the definition of carbohydrate. Okay, whatever I am teaching you in the class, each and every line will be used in question, so don't think that I am wasting your time. Okay, yes, I will not put extra burden on you. So in complete biochemistry, what I said, generalized statement. I told you whenever I will use generalized word means you can apply this concept to each and every question, and every time you will find the correct answer. Yes, at any place, it may be lipid, genetics, at any place, if you find OH, you will say the compound is having polarity. OH group provide polarity to the compound. So any compound which is having OH is polar. Second point, any compound which is having OH can be associated with phosphate, means hydroxyl group. You may write like this: OH group has tendency to attach with phosphate. OH group has tendency, yes, I will use it in genetics also. OH group has tendency to attach with phosphate. So you must have heard many times glucose 6 phosphate. Yes, carbon number 6 OH is there. Fructose 1 phosphate. Fructose is having OH at C1. So wherever OH group is there, it will attach to phosphate. Why it attach? I will explain. For the time being, OH group has tendency to attach with phosphate. If OH is there, suffix is ol and compound is polar. Got the point? Yes, not related to the carbohydrate. What I said, it is not related to the carbohydrate, but I again tell you, we will try to integrate different aspects. Okay, so there is a mnemonic. Oh, try 3 sari. This is mnemonic for amino acid. What I said, this is mnemonic for amino acid. So make a box. What does box means? Everything would be systematic. Yes, I have given these handouts. I will use each and every space. Okay, so that in last you will have only these 50-60 pages. Okay, and these 60 pages you will revise and you will solve all question of biochemistry. Got the point? The concept of giving handouts. I was the first person who started giving handouts in 2008, particularly for biochemistry. Okay. Yes. Oh, try 3 sari. Tri means tyrosine. Tyrosine. 3 means threonine. Threonine. Sari means serine. Yes, you must previously when I used to teach, I never tried to club these things, integrate these things, because previously student used to say, sir, no, this is a part of carbohydrate or lipid. Sometimes this happened to me. Okay, but now you should integrate different things, so I will try to integrate. So these 3 amino acid are having OH group in their side chain, and I told you any amino acid, any compound which is having OH group is polar. So these 3 are polar. Yes, what about tyrosine? I will discuss with amino acid. For the time being, remember these are polar amino acid. Yes, question is asked, which amino acid is polar or hydrophilic? Yes, polar means hydrophilic. Polar means hydrophilic. Okay, I will discuss later. And I told you any compound having OH group has tendency to attach with phosphate. So question is asked, which of the following amino acid can be phosphorylated easily? Frequently asked question. So these 3 amino acid can be phosphorylated easily. Phosphorylated easily. So this was for protein. So I leave this just to prove the mnemonic that wherever you find OH, compound is polar. So these 3 amino acids are polar. Second concept, whenever you find OH, you will say that this OH has tendency to attach with phosphate. I have proved with few example. Yes, I will use it again and again. Okay, in many more questions. So I close the box and close the discussion of amino acid. Mnemonic, OH, try 3 sari. OH means OH. Okay, now, so this is glucose and fructose. We have little bit idea. Okay, before going further, yes, as I told you initially, I try to keep speed slow just to make familiar with my accent and technique. Okay, so till now I have discussed few memory technique just to introduce that we will make mnemonic just like hexokinase helicopter, glucokinase G4 jet. Okay, second, yes, second, tangier tang, ऑरेंज कलर टोनसिल, ग्रे कलर टोनसिल, और क्या क्या फीचर्स होते हैं टेंजियर में डिजीज में आई विल डिस्कस. थर्ड, यस, हंटर, हंटर का साइन, यस, एक्स लिंक सेसिव, हंटर है मैं हूं शिकारी कुड़िए, ठीक है, मेल्स एंड नो कोनियल क्लाउडिंग. देन दिस इज रिसेंट एडवांसमेंट, थायमीन, बेस्ट मेथड इज HPLC, डायरेक्ट थायमीन लेवल इन ब्लड, but most commonly use transketolase level in blood. Three times this you will find this question. So recently they have asked in AIMS. So I am thinking that the purpose to give this question after 12-13 years, yes, again, was because now we are doing HPLC. Okay, what is HPLC? High performance liquid chromatography. I will discuss with the technique itself, don't worry. One more question, Farber disease, which enzyme is deficient? Barber disease, सिर के बाल काटता है. Sorry for those who don't know Hindi. Yes, सिर के बाल काटते हैं, ceramidase. Okay. Then I started with carbohydrate. Carbo means carbon, hydrate means water. C6H12O6, this is glucose. Glucose, fructose, galactose, mannose, all are having same molecular formula, so they are isomer. We started structure of glucose and fructose. We found the function group of glucose is aldehyde, that's why it is called aldose sugar. Fructose, the function group is keto at C2. Keto at C2. Remember this, I will give question, okay, of AIMS. एल्डिहाइड इज एट 1, ए एट 1, ए फर्स्ट अल्फाबेट होता है, कीटो 2 एट C2. दैट्स वाई दे आर हैविंग डिफरेंट फंक्शन ग्रुप, दे आर फंक्शनल आइसोमर क्वेश्चन. ओके, व्हाट अबाउट गैलेक्टोज एंड मैनोज? आई लीव इट for further discussion. And I told you so many OH. Yes, if glucose 6 carbon 5 OH, ribose 5 carbon 4 OH. Okay, so for definition, aldehyde and keto derivative of polyhydric alcohol, and whenever you find a complete biochemistry, OH is there, it is compound is polar. OH is there, it can be easily attached with phosphate. These are 3 amino acid frequently asked question which can be phosphorylated easily. All these 3 are polar. There is some controversy about tyrosine. What is the exact situation of tyrosine? I will discuss with the amino acid. So for the time being, remember tyrosine is having OH, so definitely it must have some polarity. Got the point? So now I come to oxidation, and yes, oxidation of glucose. I took this carbon skeleton of glucose. Are you understanding the concept? Please do reply. Are you comfortable with the speed, with the memory technique, with the technique of teaching? Okay, if you have any issue, you can comment. Yes, I always accept even the criticism. I am very happy if you criticize. I improve myself. Okay, so never feel that if you are criticizing, you are doing bad for me. You are improving me. Okay, so dear, this is glucose. At C1 there is aldehyde, and at C6 CH2OH. You can easily see at C6 there is CH2OH. I have not mentioned the OH group of other carbon. Why I have not mentioned, you will appreciate soon. But what we did, we oxidized this glucose. What I said, we oxidized this glucose. Oxidation means joining of O. Oxidation means joining of O. Joining of O is oxidation. Removal of H is oxidation. Removal of electron is oxidation. Again I repeat, you will use in electron transport chain. This is the basic concept. When you join hydrogen to a compound is reduced. Means joining of hydrogen is reduction. If you join oxygen to a compound is oxidized. Good. Yes. Actually, your response, I am not, yes, the reason I am asking you, yes, is not only to get feedback. Yes, I told you that I am psychiatrist also. Yes, I want your 100% concentration. I will shake you intermittently in my class, so that yes, I will give you some brainstorming questions also, some different things also, so that you will be active during the class. This is the only purpose, to get feedback from you. Got the point? So oxidation means joining of oxygen, reduction means joining of hydrogen. Okay, so oxidation, joining of oxygen, means you joined one more oxygen, so you can say it becomes COOH. This become COOH, and now it I told you CHO is present at carbon number 1, and this is called gluconic acid. Gluconic acid. I added E extra, otherwise the spelling is GLUCONIC. So gluconic acid means oxidation at C1. Oxidation at C1. Oxidation at C1, gluconic acid. Now if we, yes, now I rub it. This is gluconic acid, ONE1. Oxidation at C1, gluconic acid. Oxidation at carbon number 6. 6 is primary alcohol. Yes, no need to write, just have an idea. R1 CH2OH. This is primary alcohol. R1 R2 CHOH, secondary alcohol. R1 R2 R3 COH, this is tertiary alcohol. What I said? R1 CH2OH, primary alcohol, so this is R1 CH2OH, primary alcohol. R1 R2 CHOH, secondary alcohol. So if you see the structure of glucose, in glucose carbon number 6 is primary alcohol, and other carbon, suppose I talk about this carbon, this is R1, this is R2 CHOH, this is secondary alcohol. Okay, if you don't understand this, it's okay. I don't force you to remember extra detail, but the purpose is this. If you can understand, it's okay. If you can't understand, you can simply mug up that glucose is having only primary alcohol at C6. Primary alcohol at C6. So only one primary alcohol. If oxidation at C6 means 1 2 3 4 5 6, this becomes glucuronic acid. Glucuronic acid. So oxidation at C6, question is asked, yes, if glucose is oxidized at primary alcohol, then the compound is glucuronic acid. Clear? Now uronic means ultimate. U means ultimate. I am making mnemonic. Yes, don't worry. When we will talk about the concept, I will be totally conceptual. I am going to that also. Okay. Ultimate carbon. Uronic means ultimate, means the last carbon, uronic acid. If oxidation occur at C6, glucuronic acid. If oxidation occur at both C1 and C6, means both C1 and C6, then it becomes glucaric acid. Glucaric acid. Again I added one more E. In fact, exact it is spelled like this: glucaric acid. means oxidation at C1 and C6, glucaric acid or saccharic acid. Saccharic acid, this question has been asked many times. Okay, so glucaric acid or saccharic acid, you can easily remember. English is for one person, R for multiple person. Yes, he is, they are, there are oxidation at two places. There are two carboxylic group. Okay, is one or multiple. So I tried to simplify. Yes, if oxidation at C1, aldehyde group, yes, question is asked aldehyde, gluconic acid occur at ultimate carbon C6, glucuronic acid. If both C1 and C6, glucaric acid, ARER. So you may remember. So this is glucose oxidize at C6 and form glucuronic acid. Oxidize at C6 and form glucuronic acid. Any doubt? Now, if you have seen the structure of pentose sugar, ribose sugar, you must have always seen in DNA and RNA cyclical structure. What I said? That the structure of ribose is cyclical. In fact, we found that any carbohydrate which is having 5 or more than 5 carbon, what I said, any carbohydrate which is having 5 or more than 5 carbon atom acquire a cyclical structure. So glucose may also acquire a cyclical structure. So we found that glucose acquire a cyclical structure. This is cyclical structure of glucuronic acid. Yes, this is cyclical structure of glucuronic acid. Look at this. This is C1, 2, 3, 4, 5, 6. At C6 CO is there. This is glucuronic acid or glucuronate is the same. Yes, we found that glucuronic acid, if orientation of COOH change, what I said, orientation of COOH is changed, and if you find the structure like this, okay, means COOH is inside the ring. A question, if you remember, a question was asked in AIMS. Yes, a question was asked in INICET or AIMS, you can say. Okay. Bilkul Radha, you are absolutely correct. Let me tell you, I explain you. So this question was asked. Yes, so that which compound is this? So how to remember the structure, I will tell you. So if you want to remember that, you must have an idea. Yes, this is iodinic acid. If COH is inside, the ring, okay, then it is iodinic acid. Yes, and glucuronic acid. So glucose, if oxidize at carbon number 6, then it becomes glucuronic acid and iodinic acid. You are absolutely right that if CHO and COH is there and we want to we want to do nomenclature, you will start C1 counting at this one. But before this reaction, yes, the carbon was 6th carbon, ultimate carbon. What is the question? That, yes, the question is that at ultimate carbon or C6 carbon oxidation occur that lead to glucuronic acid. So after formation of glucuronic acid, it's okay. Radha, you are, yes, whenever you think differently, I am always happy. Yes, whenever you are recalling the previous thing, okay, what is the purpose? Yes, I told you that in my 50 hours class, more than 50 hours, yes, you will learn the memory things. I have worked a lot on memory techniques. Okay, and the ultimate goal is integration. Whenever you are thinking a topic, a word, yes, you should recall all the information you know about that. And when you will learn this, there is no need to integrate different subjects. You will always integrate yourself only. And this is my motto of this class. So whenever you are thinking deeply means I am happy. If you ask question, I am quite happy. But yes, when you ask me a question, I will give you one or two more important point. Yes, the structure of glucose is little bit different. Yes, I will tell you when anomerism. Yes, when I will tell you anomerism, at that time that compound means glucose having 5 or more than 5 carbon atom acquire a cyclic structure. When they acquire a cyclic structure, then glucose, the keto acetaldehyde group B will become hemiacetal group, and then the numbering system would be changed. Okay, so don't be get confused. Simply remember, oxidation of primary alcohol or oxidation of C6 lead to glucuronic acid, and we remember, yes, by aldehyde group, this is the functional group. Okay dear, so don't worry, everything is okay. So if you don't remember so much of detail, if you could not understand what is the purpose of this class, if you could not understand, it's okay. What you will do, at least you must be able to solve the question. If you understood, it's okay. Not understood, yes, at least you must solve the question. Question is asked, yes, oxidation at C1, gluconic acid ONE1, gluconic acid ONE1, or aldehyde group gluconic acid, aldehyde present at C1. If primary alcohol is oxidized or C6 is also oxidized, ultimate carbon is oxidized, U for ultimate glucuronic acid. When both C1 and C6 are oxidized, R glucaric acid or saccharic acid. We found that when glucose is oxidized at C6, then it may form what I said, glucose. Glucose has two form, glucuronic acid and iduronic acid. Again I repeat, glucuronic acid and iduronic acid. Whenever you will find iduronic acid, you will think it as this is derivative of glucose or it is glucose having COH at its sixth carbon, and in this COO is present inside the cell, inside the ring, sorry. Okay, in fact it is not inside the ring, but we represent like this. Suppose this is cyclic structure of glucose, glucuronic acid, then yes, okay Ujjwal, I am going to describe. Yes, I will discuss it again. Again I am repeating, I will discuss it again with isomerism. What is the purpose to discuss separately? Yes, usually traditional way we discuss first we discuss glucose, then their classification, their isomerism, but I don't discuss like that because it becomes monotonous and your interest goes. Yes, and integration is not possible in that way. So we found that any carbohydrate which is having 5 carbon or more than 5 carbon acquire a cyclic structure. Glucose is having 6 carbon, so glucose also acquire a cyclic structure, and we found that this is glucuronic acid. Till now as well we know. Yes, this is C6. Okay, glucuronic acid, this is glucuronic acid. What happens, this functional group, let me clarify. Yes, I will clear all your doubts, don't worry. If I am unable to complete the course in 50 hours, I will take 2-3 hours more. I may take a different session for your doubts also, so don't worry. Biochemistry is my responsibility. I assure you, after completing my class, no question across country or countries will disturb you. Okay, so if you want to know how these cyclic structure is formed, this is like this. Yes, let me draw like this. This is like this. We found that this C1 bind with C5. What I said, C1 bind with C5, and now this type of bond is formed. Previously this was double bond aldehyde, acetal bond. Aldehyde is called acetal bond, and now this double bond is lost. Now it become hemiacetal bond. What become? Hemiacetal bond. Okay, hemiacetal bond. If you don't remember, it's okay, and it make a cyclic structure, and the cyclic structure is like this. Okay, if you don't remember the exact cyclic structure, just remember, okay, there is a cycle and there is COH. There is COH. If COH is outside, it is glucuronic acid, and the name itself tells you I for inside, I for inside. So if COH is inside the ring, then iduronic acid, and they are, thank you Radha for appreciation. Yes, iduronic acid. So they gave, why I am teaching you in this way, the reason is that they ask in AIMS, they gave structure and they ask what structure is this, and when you will see the structure like this, yes, heparin sulfate, chondroitin sulfate in different test books, I'm not saying guide, in different test book you will find different structure of heparin. What is the reason and how you will solve the question? Yes, I will tell you. So for the time being, yes, I am taking little bit more time in this topic, because yes, I predicted in my previous class that this is hot topic they asked recently, and this time in NEET they asked the question, simple question, repeat question. I don't say that I am very good predictor, but they asked question on this topic. Why they asked this question? Why this topic mucopolysaccharidosis is hot topic? Because we have developed enzyme replacement therapy for mucopolysaccharidosis. Many mucopolysaccharidosis, now we have treatment in the form of enzyme replacement therapy, and that's why this is the topic, hot topic. So whatever new things are occurring in biochemistry or any subject, yes, you will find that that is the potential topic. So I will take extra time in this, so don't worry. So I say glucaric acid, yes, again I say, if you forget, I will comment these statement. If you forget it, it's okay. If you forget it, okay, just remember, you will see the structure, and if you find, yes, COO inside, I for inside, iduronic acid, CO outside, glucuronic acid, that is sufficient for me. Okay, this is glucaric acid. R मतलब हिंदी में बता देता हूँ, यस, कुछ तो समझ गए होंगे। हिंदी में एक बंदा होता है तो उसके लिए इज यूज करते हैं, दो बंदे होते हैं तो आर यूज करते हैं, यू आर, दे आर, तो मतलब दो कार्बोक्सिलिक ग्रुप हैं तो ग्लूकारिक, मैं कहता हूं कि अपने सभी सब्जेक्ट्स में अपने टॉपिक की स्पेलिंग चेंज कर दो, स्पेल करना डिफरेंट कर दो, क्वेश्चन निमोनिक बनने शुरू हो जाएंगे। यस, मैं तुम्हें बहुत सारी टेक्निक दूंगा निमोनिक बनाने की, मैं बता चुका हूं। आई हैव पब्लिश सो मैनी पेपर्स एंड आई हैव वर्कड ए लॉट on memory technique. Yes, during my MD psychiatry, I published many paper, okay, and I researched a lot on memory technique. So clear? Now I am starting with very hot topic, mucopolysaccharidosis. The base I have already made. And now I will discuss this mucopolysaccharidosis in a mnemonic way and conceptual way. Mucopolysaccharides. Another name is glycosaminoglycans. Another name is glycosaminoglycans. Yes, you all know COOH is acid. You all know COOH is acid, and I just told you that carbohydrate having 5 or more than 5 carbon acquire a cycle structure, and I told you the structure of glucuronic acid. So you can say glucuronic acid is acidic sugar. Can you say this? Yes, glucuronic acid is acidic sugar. And I told you that glucose can form glucuronic acid and ioduronic acid. Yes, if COOH is inside the ring. In fact, I told you, yes, I forgot, yes, I was yes, I left that topic. Suppose this is cycle structure of glucose. Now this COOH may be above the plane. If it is above the plane, this is glucuronic acid. If it is below the plane, yes, this my pen is COH. Yes, if COH is above the plane, glucuronic acid. Below the plane, it is ioduronic acid. So above the plane, below the plane means orientation is changed and a compound is changed. I said orientation is changed and compound is changed. I will use this at many questions. Orientation change, compound is changed. This ioduronic acid, to show ioduronic acid, we keep COH in the ring. Got the point? So you will remember, if COH in the ring, ioduronic acid. These are acidic sugar. Now if I ask you amino sugar, glucose is attached with amino group, so you can say glucosamine. Simple amino sugar. If you join acetate, CH3COO minus, this is called acetate. You all know CH3COOH, acetic acid, acetate. Okay, so if you join COCH3, you will say this COCH3 is joined with nitrogen, so N acetyl glucosamine. So if you join acetyl group to this amine group COCH3, so you will say we joined acetyl to N, so N acetyl glucosamine. Okay, so this is amino sugar. So simply remember amino sugar and acidic sugar. We found that mucopolysaccharides, what I said, mucopolysaccharide or glycosaminoglycans are polysaccharide. What I said? Polysaccharides. You will say, sir, you have not discussed about monosaccharide, disaccharide, oligosaccharide, and you started polysaccharide. Yes, I started with polysaccharide. You all know the concept, basic concept. Yes, polysaccharide I am discussing means we found that glycosaminoglycan or mucopolysaccharides are made up of acidic sugar and amino sugar multiple time, n time. So combination of acidic sugar, amino sugar multiple time. Acidic sugar you can remember uronic acid, ioduronic acid, derivative of glucose, glucosamine, N-acetyl glucosamine. Yes, I have not discussed about galactose. It may be galactosamine, N-acetyl galactosamine, but glucose is glucuronic acid and ioduronic acid. Now, so you know the structure. Now we come to the mnemonic part and how questions are solved. You will find I have written S. S means sulfate. You all know sulfate, negative charge. So mucopolysaccharides are having negative charge. Due to this negative charge, yes, this polymer has a structure, yes, which repel each other, means their inner component repel each other. and we found that glycosaminoglycan absorb large amount of water. They absorb large amount of water. When they absorb large amount of water, it becomes mucus like. Yes, mucus like structure. That's why glycosaminoglycan are called mucopolysaccharide. So again I repeat, we found that glycosaminoglycan were having acidic sugar and amino sugar, and this was polysaccharide. We found they are having sulfate. Sulfate was having negative charge, and we found that this compound absorb large amount of water. When this absorb large amount of water, they form mucus, gilgily like structure, and that's why these polysaccharides are called mucopolysaccharide. And these are present in those places in our body where we require shock absorbance property. Means you must have seen in Talent plus 2, you must have read that when two negative charge come closer, as they reach to each other, their force increases. In the same way, yes, their force increases. In the same way, suppose a mucopolysaccharide that is chondroitin sulfate, which is present in cartilage bone. What I said, chondroitin sulfate is present in cartilage and bone. Don't write, don't get confused. Yes, I will do it intermittently. Yes, so if bone is having chondroitin sulfate, and when there is a pressure, these two molecules having negative charge will come closer, and the opposite charge will repel each other, so will not, yes, this will act as a shocker or shock absorber. So wherever we want shock absorbing property, we have mucopolysaccharide. Got the point? So mucopolysaccharide have shock absorbing property. They absorb large amount of water. Yes, they have negative charge due to sulfate, and due to this mucus, yes, this becomes slippery. Yes, slippery. Mucus is slippery. So these are property of mucopolysaccharides. Now all mucopolysaccharides are having sulfate. All mucopolysaccharides are having sulfate except hyaluronic acid. Start writing. Yes, if you have space, if you have taken printout, start writing. All mucopolysaccharide have sulfate except hyaluronic acid. What I said, hyaluronic acid. First question, if yes, in hyaluronic acid sulfate is not there, if you are given a structure, yes, and you are asked which structure is this, just like in this question, they gave this structure names and ask which mucopolysaccharide is this. Yes, mucopolysaccharide. I just repeat the name: heparin, heparin sulfate, hyaluronic acid, chondroitin sulfate, dermatan sulfate, creatine sulfate. They are mucopolysaccharide, or they are glycosaminoglycan, and all glycosaminoglycan or mucopolysaccharide are having sulfate except hyaluronic acid. So whenever a structure is given, you will see sulfate. In this, look at this, sulfate is there, it can't be hyaluronic acid. Sulfate is there, it can't be hyaluronic acid. Sulfate is not there, hyaluronic acid. So in AIMS, this question was not difficult question. Again I repeat, in AIMS the question was not difficult question. If you have read the concept, you can solve it easily. In this, yes, if you see this structure, yes, no sulfate, simply answer is, yes, please do reply, no sulfate. Answer is hyaluronic acid. Answer is hyaluronic acid. So no need to think, I will give you these mnemonic and you will proceed in the same way. If a question has been asked, they may repeat. they may repeat. So if the structure is given, how you will solve? First you will look for sulfate. Okay. Second, you will write keratin sulfate. Keratin sulfate has no uronic acid. Keratin sulfate has no uronic acid. What I said? Keratin sulfate has no uronic acid. It may be gulk or it may be iduronic acid. What I said? It may be gulk or it may be iduronic acid. Okay, so whenever a question is asked, yes, again I repeat, whenever a question is asked and structure is given, yes, first thing you will look for sulfate, and you found no sulfate, the answer would be hyaluronic acid. Then you will search for carboxylic group. What I said? Acid. What I said? Acid. You will see for carboxylic group. You will see for carboxylic group. Means carboxylic group is there. It can't be keratin sulfate. What I said? Carboxylic group is there. Carboxylic group is there. It can't be keratin sulfate. Yes, but you will say, sir, we will forget इतनी सारी मेहनत. How can? Yes, we will remember. Yes, I say in Hindi. Sorry for those who can't understand Hindi, but they will remember the concept and they can transform it in their own language. Okay, in their own language. Yes, yes. So यदि तुम कीर्तन कर रहे हो, कीर्तन तो तुमने सुना होगा, कीर्तन मंडली, तो वहां पे पेशाब करोगे यूरोनिक एसिड? नहीं. कीर्तन मंडली नो यूरिन. कीर्तन करोगे तो वहां पेशाब नहीं करोगे. keratin sulfate no uronic acid. Okay, this is cheap mnemonic, but yes, it's not so good, but it's the concept you can make. Yes, how you can, the concept how you can make mnemonic. Third is you, yes, 2 points you are clear. Third point, most of time you will solve question by these two only. Again I repeat, most of the time you will solve question by these two only, but I will give you further description also, because we never know, because next is going to happen and they are more and more clinical, so you must know. You will see two units. You will see two units. Suppose you see these two units, glucose. I told you iduronic acid is also derivative of glucose. Okay, so if both units are glucose, if both units are glucose, then it may be heparin sulfate or heparin. Both unit are same. Both unit are glucose, matlab same. Both units are glucose, matlab same. Then the answer would be heparin or heparin sulfate. Got the point? So now, if one unit is, yes, I am making it complicated, I know it becomes difficult, but if you will see your guide or test book, yes, you will find 6 structure. It's very difficult to remember. I know that it is difficult, but I can't leave it in between. So mnemonic is, yes, if both units are glucose, then it would be either heparin or heparin. Simple mnemonic is heparin. I for iduronic acid. I for iduronic acid. Yes, I have given in your handouts, but if you don't see handouts, and I ask you, yes, please tell me what is this mucopolysaccharide. I ask you which mucopolysaccharide is this, please do reply. Yes, which mucopolysaccharide is this? You will follow the rule. What I said, you will follow the rule. sulfate is there, it can't be hyaluronic acid. COOH is there, it can't be keratan sulfate. Two options are ruled out. Two options are ruled out. Please do reply. Yes. Ujjwal, Radha, Bhagya, Chill, Sat, Akanksha. Okay. Plasma cell is also there. Okay. Happy plasma cell. Yes. Good. This is heparin. Very good. Yes. Simply I. Yes. So we ruled out two. Both units are glucose. So either heparin or heparin. Heparin sulfate or heparin. So hydronic acid inside means hydronic acid. Inside means hydronic acid. So this is heparin. So simple. So simple. Okay. Good. But yes, I would like to mention here, dear, yes, because you may get confused. No, Akshay. Yes, yes. Let me tell you. Yes, in few textbook you will find that in heparin, what I said, yes, if you don't know, it's okay. Either they will not ask question. If they ask question, you will go with the same concept as I told you. Good. Yes, the only purpose to ask you these question is that are you getting these things or not. Okay. Yes, in the by that I can change my speed. Yes, adjust my way of teaching. Yes, very important point. If I say heparin, in heparin, yes, majority, in majority means maximum portion is hydronic acid. I say N means multiple. Yes, both are not glucose. I told you hydronic acid consider as a derivative of glucose. Yes, I told you here only. Yes, and here also. Yes, these are derivative of glucose. Hydronic acid, consider hydronic acid as derivative of glucose. Okay, Sharik. So few modifications are required. So yes, hydronic acid you will consider as a derivative of glucose. Yes, suppose these are 100 molecules. This is a polysaccharide, heteropolysaccharide, and in this 100 molecules are there. We found that 70 molecules are having hydronic acid, but 15 molecules may have glucuronic acid. What I said, don't write. I am giving the concept so that in future you may not you may be very confident before marking the answer. Yes, what I said, suppose this is N, 100 molecules are there. Out of 100 these two units, we found that 70 units are having hydronic acid, but 30 unit is having glucuronic acid. So in few textbook, not guide, yes, in few textbook you will find they have given the structure of heparin, same thing, and they have put this. And when we see the structure of those textbook, we say why heparin is having COH outside, it should be inside. This either textbook is wrong or sir is wrong. So I say that out of 100 molecules, maximum molecules are having hydronic acid. Maximum molecules are having hydronic acid. Either they will not ask question. If they ask question, you will consider the most commonly it is hydronic acid and you will go with this concept. Clear? Did you get this point? This is a very important point, because when you will see your textbooks, yes, standard textbook, you will see, yes, they have given heparin as like this at few places. It doesn't mean that it is having glucuronic acid only or it is having iduronic acid only. In fact, heparin is having both iduronic and glucuronic acid, but majority is iduronic acid. If they ask question, you will consider this, or they will not ask question. Got the point? Now, if both units are different, means one glucose, one galactose, then it may be, yes, dermatan sulfate or chondroitin sulfate. Okay, dermatan sulfate or chondroitin sulfate. So simply mnemonic, iduronic acid. मैं तुम्हें हमेशा कहता हूं, नाम अपने आप बहुत सारी चीजें बताते हैं. यस, वेन एवर यू रीड ए नेम, द नेम विल ट्राई टू टेल समथिंग अबाउट इट. समटाइम्स दे क्राई, चिल्लाते हैं वो कि मेरा नाम ये है, मेरा निमोनिक रिकॉग्नाइज करो. एंड व्हेन आई सी फार्मा एंड माइक्रो, they literally cry, they literally shout, please make mnemonic by my name. Yeah, this is the fact, dear. Yes, I will give you, yes, I will remain connected with all of you and will show you the a different world of medical mnemonics. Okay, so during this 50 hours journey, yes, you will really appreciate the power of your mind. Okay, so for the time being, yes, iduronic acid, D for dermatan sulfate, means if iduronic acid is dermatan sulfate, if iduronic acid is not there, means glucuronic acid, then chondroitin sulfate. Now if I ask you question, yes, what is this compound? Now you can easily remember. Again, you will follow the rule. What I said, you will follow the rule. First is you will look for sulfate. Sulfate is there, it can't be hyaluronic acid. Then you will see COOH. If you see COH is there, it can't be creatine sulfate. Third, both units, glucuronic acid, galactouronic acid, means both are different. So this compound is both are different, either chondroitin or dermatan. But if COH is outside, means glucuronic acid, means it is please do reply, chondroitin sulfate. So what is this? This compound is chondroitin sulfate. So you will remember this simple mnemonic, and trust me, no question will disturb you about the structure. Yes, I will give you only relevant structure. Again, I am telling you, I will give you good chondroitin sulfate, good Radha, good. So now you can easily recognize these structures, I know. Okay, yes. So but remember, the sequence is important. Yes, you will start solving, and again I repeat, yes, sometimes what happens, we in the last of I am preparing for your exam. I usually say I am not here to teach you biochemistry, or sometime, yes, when I teach psychiatry, I usually say I am here to improve your rank. Yes, in last time, if you find that you are not having so much of time of revising, trust me, make a box and put this in the box. Remember these two. And many times, yes, this question has been asked at various places, just like MRCP level, yes, and MLE pattern, yes, in fact MLE pattern, so many questions are there. So only these two are sufficient to solve most of the question. Okay, but you know all these things. Okay, so let me discuss fast. You know all. Yes, heparin. Yes, in itself tells you intracellular. In intracellular. All mucopolysaccharides are extracellular except heparin. नाम अपने आप बताएगा तुम्हें heparin is intracellular mast cell. Okay, and yes, it is made up of glucose and yes, mast cell, liver, lung, skin. Okay, so no need to remember, mast cell is frequently. Heparin sulfate, skin, kidney, basement membrane. Yes, you will remember heparin sulfate. Yes, suppose this is, it's I avoid few points. What I said, I am avoiding few points at this place, just like heparin sulfate and heparin few property I will discuss with lipoprotein lipase. When I will discuss lipoprotein lipase, don't write here, don't congest at this place. When I will discuss lipoprotein lipase, I will tell you lipoprotein lipase is attached with endothelium with the help of heparin sulfate. With the help of heparin sulfate, at that time I will give you diagram also. Yes, we found that suppose this enzyme is lipoprotein lipase is attached with endothelium with the help of heparin sulfate, and if you inject heparin dissociate this lipoprotein lipase from endothelium. So just have an idea, no need to write. I will discuss with lipoprotein lipase. Hyaluronic acid, it's quite commonly asked question. Yes, it is present in synovial fluid. Yes, frequently asked question. Chondroitin sulfate, I told you chondroitin itself tells you cartilage bone. Dermatan sulfate, name itself tells you derma, skin. Okay, don't worry. Keratin sulfate, heparin and dermatan. Okay, I told you same unit and different. Okay, yes, same unit and different unit. Okay, Roger. Keratin sulfate is present in cornea. Keratin sulfate is present in cornea. Okay, keratoplasty, you can also remember name itself tells you keratoplasty. Yes, this time NEET question was asked, this repeat question. Yes, keratin sulfate is responsible for the transparency of cornea. Clear? Any doubt? Is Roger, I told you if same units are, both units are glucose, then it would be heparin. Okay, if both units are means different, then it would be galactose would be there. In dermatan sulfate, galactose would be there. Okay, so again I highlight this. Yes, these things are not absolute, because in real life these things, yes, the concentration may change, means some amount of other things are also there, but majority this is the composition. So I usually say, if you remember these two, maximum time you will find the correct answer. Okay, now we start discussing mucopolysaccharidosis. Yes, as I told you, in mucopolysaccharidosis, there is recent advancement that we have successful enzyme replacement therapy. So we will discuss one by one. MPS, mucopolysaccharidosis. Mucopolysaccharidosis. In mucopolysaccharidosis, you will find that lysosomal enzyme, hydrolase. Yes, what is hydrolase? I will discuss for the time being. Yes, lysosomal enzyme hydrolase is deficient. Okay. Yes. So these all mucopolysaccharidosis are autosomal recessive. Autosomal recessive means these compounds are hydrolyzed. Yes, I will discuss classification of enzyme, and at that time I will tell you hydrolysis. Hydrolysis means cutting a bond with addition of water. What I said? Hydrolysis means cutting a bond with addition of water. Okay, so hydrolases cut a bond with addition of water. If these enzymes are deficient, then mucopolysaccharidosis. Now common features, all mucopolysaccharidosis are autosomal recessive except Hunter's disease. I have already discussed. Yes, Hunter disease is X-link recessive. Why I am pointing again and again, yes, moving again and again, showing this picture? The purpose is that you should understand that whenever you are having an idea about a topic, yes, if you are recalling a word, if you are reading a word, yes, try to recall whatever you know about that thing, and you will automatically integrate the content. Okay, so all are autosomal recessive except Hunter's disease. Now common features of all mucopolysaccharidosis. Common features of all mucopolysaccharidosis. Yes, this is frontal bossing. Yes, frontal bossing, depressed nasal bridge, depressed nasal bridge means coarse facial feature, coarse facial features. What does it mean? Yes, I am saying the common symptoms of mucopolysaccharidosis means these symptoms would be present in all mucopolysaccharidosis. So when you will find clinical question, so just try to ignore these types of, we should not do that, but yes, don't focus so much on these symptoms. What happens, we are sometimes so much engaged with these symptoms, we leave the key point. So these are common features means will be present in mucopolysaccharidosis, all mucopolysaccharidosis. Coarse facial features, frontal include frontal bossing, depressed nasal bridge, gingival hypertrophy, yes, large tongue, yes, corneal opacity, yes, corneal opacity may be there. Most of time corneal opacity would be there. There is dysostosis multiplex, you can easily remember. Disturbance of bone, dysostosis multiplex, multiple bones are disturbed, just like you will find bullet shaped finger, yes, or bullet shaped middle phalanx. Yes, you can see this is normal phalanx, normal, this is bullet shape, middle phalanx. Yes, bullet shaped middle phalanx. Okay, there is beaking. Look at this beaking of vertebra. Beaking of vertebra. Yes, this is beak. Yes, this is beak. Beaking of vertebra. Okay. So dysostosis, multiplex, multiple bones are deformed. Yes, beaking of vertebra, bullet shaped finger, middle phalanx. Question has been asked. Okay, corneal opacity, large tongue, coarse facial feature, mental retardation may be there. Okay, or one if you see WBC, then there is Rayleigh body. RIELLY, Rayleigh body. These are dark purple. Yes, pathology person would have told you better, but yes, just to integrate point out, yes, we are discussing, so at the one point it should be integrated. Dark purple, coarse metachromatic granules, coarse metachromatic granules. Okay, surrounded by clear zone, surrounded by clear zone. These are Rayleigh body. Dark purple, yes, coarse means bade metachromatic granules surrounded by a clear space. These are Rayleigh body. So Rayleigh body, bullet shaped finger, middle phalanx, beaking of vertebra, yes, corneal opacity. These are common features, and we will point out, yes, we will segregate key points and how we can make diagnosis, how we can solve question. Yes, they will give clinical scenario. So we start. You can write here only. Yes, we have space, so you can write if you want to start from this. Yes, I start here from here. Yes, MPS1, mucopolysaccharidosis type 1. Yes, I am taking little bit more time. Yes, it's a quite difficult topic and unread topic, so but they have touched this topic, so we should read it in detail. Okay, Haller disease type 1, maybe of two type, in fact, mucopolysaccharidosis type 1, or maybe of two type, 1H and 1S. 1H for Haller disease, H for Haller's disease. Haller disease, there is the enzyme alpha iduronidase. Yes, first iduronidase. Yes, sometimes even a slight hint, what I said, a slight hint is sufficient to mark the answer, because you are not to write the name of enzyme, you are to just recognize. So iduronidase, you may easily remember, first iduronidase. Okay, and this enzyme, this is enzyme, and you all know all enzymes are protein. Yes, I will discuss all these things in detail, but at this time you must have an idea. All enzymes are protein except ribozyme. Ribozyme are RNA having enzymatic activity. means the enzymes which are present in our body, most of them are protein. And you all know proteins are synthesized from messenger RNA, messenger RNA synthesized from DNA, DNA, the portion of DNA which is representing a protein, that is called gene. So gene synthesize messenger RNA, messenger RNA synthesize protein, and this is called gene expression of gene. If there is mutation of gene, if there is mutation at the level of DNA, that may affect the performance of a particular protein. So iduronidase is an enzyme, is a protein, so there must be a gene for iduronidase. We found that there is a gene for iduronidase, this is DNA, and at this DNA there is nonsense mutation. What I said is, what happens that when we discuss different things, we can't determine the sequence, at which sequence we should teach. That's why I am trying to connect, yes, basic knowledge we you all are having, but it's essential to recall. Yes, all enzymes are protein except ribozyme. Ribozyme are RNA having enzymatic activity, means iduronidase is an enzyme, it is also protein. You all know proteins are synthesized from gene, means gene is DNA, DNA synthesize messenger RNA, messenger RNA synthesize protein, and this is called gene expression, means gene can't do function, DNA can't do function. If DNA want to do function, it synthesize messenger RNA, messenger RNA synthesize protein, and protein do the function. So DNA is master, messenger RNA, M for messenger, M for RNA, manager. Messenger RNA is manager, and the protein is the laborer, worker, and done function is done by protein. So suppose there is mutation at the level of gene of iduronidase, and we found there is nonsense mutation, nonsense mutation. Nonsense mutation means, yes, putting stop codon, I will discuss in detail. Yes, then complete deficiency. Yes, write down, question was asked, complete deficiency, complete deficiency of iduronidase. And if iduronidase is deficient, yes, there would be IHD, HD, ischemic heart disease, like that. I made the mnemonic. Heparan sulfate, H for heparan sulfate, heparan sulfate and dermatan sulfate increased. When heparan sulfate is increased, yes, this heparan sulfate will accumulate, it cause mental retardation. Yes, just remember, heparan sulfate cause mental retardation. So in this patient, Haller disease, you will find mental retardation. Okay, so in most of the mucopolysaccharidosis, those are all are most of them are autosomal recessive, and they are having mental retardation, and heparan sulfate is responsible for mental retardation. We found that first, yes, mucopolysaccharidosis, first S is she disease. Yes, now after some time, and then after the break, I will increase the speed. Okay, are you comfortable with the speed? Please do reply. Yes, I know that this is a difficult topic, that's why I am taking a little bit slow speed. Okay, so if you are comfortable with the speed, it's okay. If you feel that it's little bit slow, I can increase. Okay, she disease, SCHEIE, she disease. In this, the same enzyme is deficient, that is alpha iduronidase is deficient. Are you comfortable with the speed? Yes. In this there is missense mutation. In this there is missense, missense mutation. If missense mutation is there, then there is yes, nonsense, protein synthesis stops. Missense, yes, protein will be formed but deformed, partial activity would be there. Yes, thank you. Yes, so missense mutation, yes, partial. Okay, Deepti. Missense mutation, partial means there would be partial deficiency. You can say here, right here, that this is a partial deficiency. Yes, I have not done it deliberately, but it happened spontaneously. Partial, red, green, purple, red. So partial. She disease, slight activity is present, and in this only dermatan sulfate is increased. Dermatan. Yes, don't make any logic in this. Again I say, don't make any logic that why dermatan, why heparin. Yes, just remember dermatan sulfate increases, no heparin sulfate, so IQ is normal. So sometimes you will find question on MPS 1. Yes, MPS 1, they will give the symptoms, clinical question, the same symptom, more or less same symptoms, and you will find that either they will give complete deficiency. This has been asked in MLE pattern, complete deficiency and partial deficiency. If partial deficiency, C disease; complete deficiency, Hurler disease. Yes, nonsense mutation, this question has been asked. Okay, so mental retardation, IQ, this may be differentiating point when you find that similar picture is given just like Hurler and Sheet disease, so you can easily recognize. Clear? And yes, this Hurler disease is having Rayleigh body. This Rayleigh body is present in Hurler disease. Yes, MPS second, yes, mucopolysaccharidosis, that is Hunter's disease. Hunter's disease. Hunter's disease. I have already told you about Hunter's disease. Yes, X-linked. Yes, Hunter's disease X-linked. Yes, I have given this diagram here only. X-linked recessive. So this is more common in males. Hunter's disease type 2. So the enzyme is iduronate sulfatase. Yes, how to remember? दो मतलब two words, one word. आइड्यूरोनिक एसिड तो तुम याद रखोगे ही. यस, दो वर्ड हैं तो टाइप 2, एक वर्ड है आइड्यूरेंडेज टाइप 1. Yes, that is the reason I initially told you that don't apply logic in this. Yes, this is the reason I told you don't apply this logic. Yes, because many things can't be explained every time, dear. Yes, but this is the fact. If heparin sulfate is there, it causes mental retardation. This may be a question, but why heparin and why dermatan are accumulating? Yes, it's it should be heparin for according to you. But I told you, dear, that it's not the exactly having only and only iodinic acid. Heparin is also having glucuronic acid and iodinic acid both. Okay, and the mechanism of these enzymes is little bit complicated, so I am not going in detail. The purpose, yes, previously we used to yes skip this topic, but recently they have asked, that's why I am mentioning it in detail with the clinical correlation. Okay, so don't apply logic at this level, please. Okay, I apologize for that, that I am not able to explain. Yes, I tried a lot that I could find a correct logic, by that I can explain. Yes, if you ask me about yes, other lysosomal storage disease, sphingolipidosis, I can explain each and every symptom of that. If you ask me about hyperlipidemia, as I will discuss, I will explain each and every symptom in detail. But mucopolysaccharidosis, I could not find the explanation. Okay, dear? Yes, few points I can't explain, but whatever I am giving you, that would be sufficient to solve your question. Okay, in this, both dermatan sulfate and heparin sulfate, both dermatan sulfate and heparin sulfate, yes, there would be mental retardation, there would be mental retardation. And in this, no corneal opacity. Yes, I have already told you, no corneal opacity. Okay, so type 1, type 2, yes, is, I think I have left few important points, yes, about common features. Yes, sorry for that. Yes, when I think about yes, Hunter disease, you will find question in which you will find that visceromegaly, sorry to tell you in between, visceromegaly means there would be hepatosplenomegaly, hepatosplenomegaly. Yes, when hepatosplenomegaly is so large, then it will make a pressure, protuberant abdomen, protruded abdomen, and sometimes the pressure due to there is hernia, that lead to hernia. So hernia, protruded abdomen, hepatosplenomegaly, visceromegaly, these yes, frontal bossing, depressed nasal breeze, large tongue, corneal opacity, these are common features. Yes, and I told you mucopolysaccharidosis type 1 and type 2. Yes, and the enzyme, yes, now 3, 4, 5, 6 and 9, yes, these are, yes, I am going to discuss. I think we should take a short break. After that I will discuss remaining, and at which places enzyme replacement therapy is there, and what advancement has been done. Yes, which enzyme replacement therapy has come recently, so I will try to tell you, so that may be a potential question. So we take a short break. Yes, please do comment. Yes, is this the way you are enjoying, or should I change? Definitely I have not given you the basic conceptual thing. When I will try to connect these things, this is fructose metabolism, just to tell you, this is fructose metabolism based on mnemonic, everything would be mnemonic, glycolysis, gluconeogenesis, and at the same time I will club it with HMP shunt. So yes, you can't arrange in this way, but I will try to make a flow chart, so that you will remember the you will understand the holistic approach of biochemistry. So we take a break. After that we will start with the remaining mucopolysaccharidosis and their features, how to differentiate them by single words. Okay, just like if I say mental retardation, yes, there are 3 mucopolysaccharidosis where mental retardation is not there. Okay, one is She disease, I told you, सेकेंड इज मोर क्यू डिजीज, मैं कहता हूं इसे नाम ही ऐसे याद रखो, मोर आई क्यू डिजीज, मोर आई क्यू डिजीज मतलब नो मेंटल रिटार्डेशन, इनफैक्ट द नेम इज MORQUIO डिजीज. ओके, दिस इज MPS टाइप 4. ओके, सो मैं कहता हूं इसको मोर क्यू डिजीज को मोर आई क्यू डिजीज याद रखो. Remember it like that. So we will remember these types of mnemonics. So for the time being we take a break. Okay, break of 15 minutes. Okay,